Have you ever been fascinated by how a single genetic test could unlock your ancestry secrets or pinpoint your disease risks? Imagine a test tailored to identify the best medication for you, considering your unique condition and genetic makeup while mitigating adverse effects. I'm Julia Kuchmak, and today we're exploring pharmacogenomics. This emerging field in precision medicine offers more than clinical benefits. It's pivotal in advancing sustainability within the Canadian healthcare system. Let's uncover how pharmacogenomics harmonizes healthcare with environmental stewardship. Let's consider the essence of sustainability, not just as an abstract concept, but the deliberate, careful management of our planet's resources. It's about fostering a balance that meets today's needs without hindering future generations from meeting theirs. Often, the narrative of sustainability unfolds through initiatives designed to untangle a web of collective action dilemmas, where individual self-interest can sometimes lead us astray from achieving the greatest good for our communities and well-being. In healthcare, this means balancing environmental conservation while enhancing patient care. We stand at a critical point where our health systems must support societal growth and ecosystem health. Let's explore how healthcare can promote both community well-being and environmental vitality. Pharmacogenomics transforms medicine by tailoring treatment to your genetic makeup, making the generic trial and error approach obsolete. Its application across psychiatry and family medicine promises treatments precisely tailored to individual genetic profiles. This field not only offers personalized but also precise treatments. An astounding 90% of us have genetic variations affecting our response to medications. Pharmacogenomics, leveraging genetics, pharmacokinetics, and pharmacodynamics alongside environmental and demographic data, helps healthcare professionals customize the safest and most effective treatments for their patients. Let's delve into how pharmacogenomics intersects with the three pillars of sustainability: environmental, social, and economic. This examination is key to understanding the broader implications of our healthcare decisions as it relates to our collective well-being and ecosystem health. The UN Environment's Frontiers 2017 Emerging Issues of Environmental Concern report highlights the link between pharmaceutical discharge and antibiotic resistance. With an aging global population, the demand for pharmaceuticals is surging, raising significant concerns about pharmaceutical pollutants. Pharmaceutical compounds, while designed to improve health outcomes, increasingly contaminate our water systems. Sources of environmental release range from direct emissions during drug manufacturing to disposal of expired or unused medicines, patient and animal excretion, and aquafarming. These pollutants, even in low concentrations, can disrupt ecosystems and human health, with emerging research suggesting potential long-term impacts that are exacerbated through biomagnification. For instance, the presence of synthetic estrogens from contraceptives in Alberta's waters have been linked to reproductive impairments in wildlife, with cascading effects on reproductive health and cancer risks across generations. Particularly, rural and Indigenous communities face heightened risks from pharmaceutical pollution, highlighting disparities in health outcomes and access to care. A study examining water quality across 17 First Nations communities in Ontario revealed detectable levels of pharmaceuticals, including antibiotics and contraceptives, in both wastewater and surface water across several ecozones. These findings, coupled with the disproportionately elevated risks for development of reproductive cancers and cardiovascular diseases Indigenous populations face, should be addressed to advance health equity. pharmacogenomic testing emerges as a promising strategy to reduce pharmaceutical waste and environmental footprint by enabling precise medication prescriptions. Addressing the challenge of pharmaceutical pollutants demands integrating environmental stewardship with medical advancements. This approach not only addresses public health, sustainability, and equity concerns, but also aligns with shifting global demographics. The pursuit of effective pharmacological therapy is fraught with challenges, including potential adverse reactions and significant financial burden. Pharmacogenomic testing, through a precision medicine lens, recognizes the impact of race, class, and gender on treatment efficacy. For instance, the alcohol flushing response, also known as the Asian flush phenomenon, is a term describing the facial flushing experienced by individuals with an ALDH2 mutant genotype. This mutation, present in approximately 10% of the Asian population and 36% of East Asians, affects the enzyme ALDH2's ability to metabolize alcohol, resulting in the accumulation of toxic acetaldehyde. Beyond its immediate effects, this genetic variation has been linked to an increased risk of esophageal cancer in carriers who consume alcohol, and influences metabolism of heart attack medications such as nitroglycerin by worsening heart attack symptoms. This exemplifies the influence of genetic variants on drug metabolism, underscoring the need for pharmacogenomic testing in treatment considerations. Another example illustrating the benefits of pharmacogenomics through a social sustainability lens is its use in cardiovascular care, through the identification of P450 isoforms, which are instrumental enzymes involved in metabolizing almost 70% of clinically prescribed drugs, enables for a genotype-guided treatment strategy. A strategy which has been vital in reducing the risk of ischemic events in East Asian patients carrying the CYP2C19 low F allele when prescribing antiplatelet medications. The cost of medications is a major concern in Canada, as it is the second highest healthcare-related expense. Pharmacogenomic testing offers significant savings over the long term. Despite initial investment, it potentiates substantial economic savings by streamlining medication selection, reducing trial and error cycles, and decreasing emergency care for adverse reactions. The economic benefits extend beyond patient savings, translating into valuable time efficiencies for healthcare professionals and staff. The reduced need for physicians to engage in the time-consuming process of identifying suitable medication alternatives, coupled with a decrease in the resources allocated to managing medication-related emergencies, represents a substantial improvement in healthcare delivery and efficiency. Subsidizing testing for lower socioeconomic groups can address healthcare access disparities, moving towards a more inclusive healthcare model. By integrating pharmacogenomic testing into the healthcare system with a focus on accessibility and affordability, we can move towards a more inclusive model of healthcare that acknowledges and addresses the socioeconomic disparities affecting access to and outcomes of medical treatment. Pharmacogenomic testing stands at the forefront of a transformative approach to healthcare, guiding us towards treatments that are both highly personalized and efficacious. Yet, embracing this innovation necessitates confronting its limitations. A critical area needing attention is research exploring environmental and health impacts of pharmaceuticals, especially their accumulation in aquatic systems. This situation presents a dual challenge: maintaining future ecological balance and addressing the effects of pharmaceutical pollutants already present in the environment. Privacy issues related to the handling of genomic data also pose obstacles. Such concerns could deter people from participating in pharmacogenomic testing, potentially limiting its application in personalized medicine. The upfront costs for patients to undergo testing, combined with expenses incurred in training healthcare professionals to use this data effectively, introduce financial and logistical challenges. Additionally, pharmacogenomic testing may uncover predispositions to certain illnesses. While beneficial for some, this knowledge could cause considerable anxiety and distress for others. This highlights the need for careful consideration in how these results are communicated and managed within the healthcare context. To navigate these challenges, a comprehensive strategy is essential. This includes continued research on the environmental consequences of drug residues, strong data privacy safeguards, initiatives to make testing more affordable and accessible, and thorough support for both patients and healthcare providers dealing with genetic risk information. Through such concerted efforts, we can maximize the benefits of pharmacogenomic testing, advancing a healthcare system that is both forward-thinking and responsive to the diverse needs of its users. In conclusion, pharmacogenomics emerges as a pivotal intersection between the personalization of medicine and the ethos of sustainability. It is the precursor to a new era of pharmacological therapy, promising unparalleled precision and efficacy in treatment modalities. More than just a scientific advancement, pharmacogenomics fosters a sustainable and equitable vision for the future of healthcare. By minimizing the need for trial and error medication approaches and mitigating their associated environmental repercussions, pharmacogenomics embodies the synergy of sustainability and science. Overall, pharmacogenomics is a tool that symbolizes progress in harmonizing healthcare practices with environmental stewardship. I hope this presentation deepened your understanding of genetic testing and its role in sustainability. Thank you for your attention.